From the RSNA, I'm Dr. Jana Ivanidze, and this is Radiology Imaging Cancer. We are back in your feed with a special podcast episode focused on this year's RSNA grant recipients. It is my honor to interview my friend, Dr. Gloria Guzmán Pérez-Carrillo. Dr. Guzmán is Assistant Professor of Radiology at the Mallinckrodt Institute of Radiology at Washington University in St. Louis, where she also serves as Director at the Office of Diversity, Equity, and Justice, as well as co-director of the Advanced Neuroimaging Service. Gloria previously was on faculty at the University of Arizona. She completed her residency in diagnostic radiology at West Virginia University and a fellowship in neuroradiology at Mallinckrodt Institute. Gloria also holds a master's in radiology from the University of Granada in Spain, as well as a master's of public health from University of Arizona. Gloria has received numerous awards and grants supporting her outstanding research, including an Institutional Career Development Award from the University of Arizona, the RSNA Röntgen Resident and Fellow Award, the ASNR Scholar Award, and an Institutional Diversity Scholarship Award from Washington University. I'm delighted to welcome you to the podcast today, Gloria. Thank you for being here.
You're welcome, Jana. Thank you.
Congratulations on your RSNA Seed Award. The topic of your proposal was precision diffusion-weighted imaging of head and neck squamous cell carcinoma. So, very interesting topic. Please tell us more about it.
Certainly. So I became interested in diffusion-weighted imaging in general during residency. And then when I went to Spain, I started seeing how much difficulty we had imaging the head and neck and determining what was post-treatment change and what was tumor recurrence. So I decided to pursue a master's of radiology at the University of Granada with a thesis on diffusion-weighted imaging of the head and neck, especially in squamous cell carcinoma patients. So I spent a year deep diving into the topic, doing literature reviews. Also, I was very lucky. I worked for a very strong private practice in Granada. And so they flew in the MR physicist from Madrid so we could work on the sequences in our clinic and, optimize imaging acquisition for these patients. I gave also a couple of presentations to the radiology department there and to the oncologists, trying to explain the advantages of diffusion-weighted imaging, especially in those post-surgical cases that were difficult to differentiate tumor from.
Very cool. Maybe for our listeners who are not as familiar with diffusion-weighted imaging in head and neck cancer, could you summarize what the advantages are, or how has it transformed clinical practice in your experience?
Certainly. So right now, the workhorse of evaluation of post-treatment changes is still CT. I think part of it is a lack of knowledge or familiarity with diffusion-weighted imaging, but diffusion-weighted imaging has multiple advantages over CT or even PET-CT. So first of all, there's no radiation. Obviously, these patients develop a lot of secondary tumors in the lung. So that's one thing. The second thing is in terms of PET-CT, for example, we don't have to wait 8 weeks or 12 weeks to image the neck after treatment. Mm-hmm. We can do it even a couple of days after, which of course allows for much earlier identification of non-responders, for example, for modification of treatment in a more timely fashion. Diffusion-weighted imaging, for example, as compared to PET, can be performed multiple times. A lot of patients, unfortunately, face barriers to having multiple PET-CTs in a year because of reimbursement. Yes. Or declining, the insurance declines to pay for the study, unfortunately, which is not the case with diffusion. The other thing that struck me when I worked in Granada back then, there were only 2 PET-CTs for the entire community of Andalusia, which is 10 million people. Wow. So having that international perspective of understanding how much more availability there is for MR imaging than PET-CT imaging also was a big driver for me, because I think we need to have a more international view of how we practice medicine and radiology in particular.
Absolutely.
And how we garner, the tools that we have, to make it easier for people that may not have a PET-MR available.
Yeah, that's an excellent point.
Right, to do high quality imaging for the patients.
Thank you for emphasizing that. Can you tell us a bit about what was your path into research like? I'm sure especially trainees listening to this who may be interested in getting more involved in research and even applying for an RSNA grant would benefit from hearing about how somebody as successful as yourself has gone on this path.
Well, I don't know about the successful part, but thank you. Anyway. So I was supremely lucky in my mentors. When I was in medical school, the head of nuclear medicine, well, she was actually the head of the department as well, Dr. Frida Silva, took a keen interest on me, personal interest. And so we started doing research together. She did and at that time, her specialty was heart imaging, SPECT imaging. So I worked with her for a couple of years doing that kind of research. And through her, I learned, how to put a protocol together, how to write a consent form, how to approach patients, especially. She was a very kind, personable physician. And she was able to transmit to the patients the importance of the research. And after I graduated, at West Virginia University, my mentor was Dr. Jeffrey Hogg, who's an excellent neuroradiologist. He's actually now emeritus at West Virginia University. Mm-hmm. And he is a powerhouse of teaching. He's won multiple educational awards. He was the chief or the CEO or the director of Aquafire, which is one of the educational portals. And through him, I just got so excited about neuroradiology and neuroradiology research. So we, wrote a paper together and did multiple posters together. He was just an incredible mentor. And so I fell in love with research and I fell in love with teaching neuroradiology in particular because of him. And then when I came to WashU to do my fellowship, Tammy Bensinger took an interest in me again for whatever reason. And, she's a powerhouse researcher. She's one of the most successful neuroradiology researchers in the country. And I don't think that's an exaggeration. So from Tammy, then I learned to refine all of those techniques of research and grant writing and, interacting with other groups as well, so networking to get the strongest group possible, within your protocol. So I was a very lucky gal. Let's put it that way.
Well, I'm sure luck is only a minimal component, but given everything you've achieved, what do you think would be good advice for, trainees who are interested in research and want to maybe consider putting together a grant application?
I think definitely finding the right mentor. I know that's very ephemeral advice, but when you have passion for something, someone is going to notice that passion and they're going to want to help you out with whatever is it that you're interested in pursuing. Definitely taking grant writing courses and statistic courses is important. I found that before I did those things, I wasn't as effective in, my grant writing and in building the research protocol properly. So those things go a long way. And, working with good people. Again, I know that sounds kind of ephemeral, but finding good, nice people that are vested in doing good work for the patients, that have the right values. Absolutely. I think it's very, very important.
Agree. So what are your plans now that you've received this wonderful grant from the RSNA? What are your plans for the future, and how do you hope this grant will maybe help you continue to develop this research program that clearly you've been passionate about for several years now? What are your plans for the future?
So what I'm most excited about this grant, it works with the Kiva, RSNA Kiva, that's the quantitative initiative biomarker alliance. Specifically the diffusion working group. So right now we do have something that's called a profile, or basically those are white paper suggestions on how to more successfully do imaging, how to standardize imaging. So for example, we have diffusion profiles for breast, we have diffusion profiles for the brain, but we don't have a diffusion profile for head and neck imaging. And that's one of the reasons that diffusion weighted imaging for the head and neck has not been widely adopted is because there's a lot of variability depending on the machine and depending on the software version. However, if you have a robust sequence that is reproducible, if you have reproducibility coefficient, or that, which is what we're doing with this project, then it's a lot easier to standardize the protocols across institutions and across machines, and of course normalize the data. So I'm very, very excited because the purpose of this grant is to be the seed for a head and neck diffusion profile for Kiva.
So this can serve as kind of the starting point for preliminary data for future NIH grant applications.
Absolutely. But more important, I see it as a service, right? If we do have a head and neck diffusion profile, stage 1, then we can hopefully move forward to stage 2 and stage 3, like happens with SUV values, for example, and really form a very solid, reproducible platform for everybody performing diffusion-weighted imaging of the head and neck, and really move forward the technique, which I think is very, very valuable.
And of course, for that, developing reproducibility is extremely important. So this is very meaningful work, and congratulations again. I want to shift gears a little bit and ask you a question, given your expertise in diversity, equity, and inclusion matters. Looking, when I was preparing this podcast, looking at the roster of grant recipients, it is clear that we as a specialty and the RSNA have made great strides in terms of increasing gender diversity and kind of getting closer to gender equity. However, there is a very striking lack of racial diversity, which of course in part is a reflection of the lack of diversity in our specialty overall, but not completely explained by that. And I would really be interested in your thoughts on what are steps the radiology community, and specifically RSNA and other large societies with grant programs should take to recruit more grant applicants and award more grants to applicants from diverse backgrounds.
Absolutely, and thank you for that question, because I think it's fundamental. So I think in the short term, we need to do a better job of sponsoring and mentoring underrepresented medicine. So again, one of the reasons I have been able to submit this kind of grants and be successful with them is because I've had a lot of really high quality mentoring and sponsorship. I've had people that have known me, that have talked about me to others, that have, made networking on my behalf. So I might meet other people in the field. And so you cannot progress in this field without both of those. I think people feel more comfortable with people that are similar to them. And we need to move away from that model. We need to make an active effort to identify those trainees, URIM trainees that have a lot of potential, and actively recruit them into research.
Absolutely.
Yeah, try to find their, what their needs are. In the long term, of course, we need to do a much better job of identifying these students early on meaning K through 12, STEM programs, the university. We don't do a good job of outreach as a specialty, I think, for these for these students. And I know personally from not only personal experience, but from conversations with med students or even university students, that they don't see themselves in radiology.
Yes.
Right? They don't see somebody like them. So they think that place is not for them. In fact, I've been told that directly. Oh, I never thought of radiology because I didn't think people would want me there. And we really need to change that perspective. And the only way we do that is by very aggressive outreach at the early stages of education.
I completely agree. And thank you very much for highlighting this. So with that, thank you so much for your time. I've learned a lot about diffusion-weighted imaging, standardization in head and neck cancer, as well as the important topic of diversity, equity, and inclusion in radiology. Thank you, Gloria.
Thank you, Jana, so much. And thank you for all the good work you do. It's very, very exciting, all your research as well. And so I hope you will be a recipient of one of these very soon.
Very kind of you. Thank you, my friend.
Thank you. Thank you.
This concludes our interview with RSNA grant recipient, Dr. Gloria Guzmán Pérez-Carrillo. I hope you enjoyed learning about Gloria's very impressive work on advanced MRI in head and neck cancer. as well as her accomplishments in diversity, equity, and inclusion in radiology. I hope everyone had a wonderful RSNA, whether in person or virtual. If, like me, you did not have much time to attend the virtual sessions live, there is still time to watch many sessions and access other content from RSNA on demand through the end of April. Thank you very much for listening. I hope that you enjoyed this episode. We would love your feedback as well as suggestions for future topics. Please subscribe on Apple Podcasts or wherever you get your podcasts and give us a rating to help more people discover this show. I'm Dr. Jana Ivanidze, and this is Radiology, Imaging Cancer. See you soon.